What's going on, everybody? Jake here with Essential Motion, and today Chris and I are going to dive into, can your hip pain be coming from your low back? And this is a common question that we've seen before, and a lot of people come in with a hip complaint, and it does end up being their low back. So we're gonna talk about that a little bit. But here's Chris.
Yeah, Chris, EHS Physical Therapy, your herniated to healthy disc expert. This is what we help you do: repair, rebuild, renew confidence in your body, in strength, in movements. Many times this can be fixed and healed. Now, my question though is, when someone asks this question, hip, we often get this question, but what truly is a hip, right? Some people will say like this is hip, which is a very common spot. It doesn't even have to have any kind of nerve issue to be referred from here to here, but it can be more like true hip or groin pain. That's what I consider. We consider
that's more
hip
common
here.
is in the groin region with a true hip.
So can a disc issue cause some kind of hip pain to that side?
Yeah. So in our minds, when you come in and you say, I have hip pain, immediately both of us think, okay, low back. We got to check the low back first.
At least rule it out first, because it's many times, probably 6 out of 10 times.
Easy.
7 out of 10 times. It is the low back. You don't even have to have pain here. You could just have hip and groin pain. Pain with deep squatting. Pain with sitting, rising, catching in the hip. Doesn't have to be a hip thing at all. It could be back.
Yeah, so we'll dive into questions. We'll start kind of piecing through it, getting all the pieces of the puzzle, putting it together, a picture in our mind of whether or not we think this is going to be from the low back or hip to begin with. But the long story short is, yes, your disc herniation can give you hip pain. So you can feel it just here. You can feel it down the front of the thigh. You can feel it down the side of the leg. You can feel it down the back of the leg, even all the way down into the foot, possibly. Yeah. So there's a lot of different ways a disc herniation can present, and it can mimic a lot of things.
Now, will it depend on what level the disc herniation is at? So you could have multiple levels. This is not uncommon to have. You go get your $2,000 MRI, which doesn't make you feel any better, but it does say, okay, you have a bulge at 3.4, you've got a herniation at 4.5, and a herniation at 5.1. And maybe your only symptoms are low back pain and right groin pain. Do we then care all that much about the 4.5 or the 5.1 or the 3.4? What would be causing kind of wrapping this pain around to the front? Or are we saying that's not the problem at all? It's true hip. How are we going to differentiate between those two things? Yeah. Knowing that we have someone who's had a special test, that someone's told them they're now broken, and now they have all these disc problems.
Yeah, so with where you have the symptoms, and then with some other tests that we can run through, we can pretty generally well say what levels your herniation or issue, we'll say disc injury, might be at. For a general rule of thumb, L1, L2, L3 is going to be up closer to that groin, front of the leg, okay? As we go lower down, L4, L5,
even knee pain.
You can have some knee pain. As we go to L4, L5, and L5, S1, those are the two most common places to have low back issues. You're going to get it more down the back of the leg, even into the outside of the leg and into the foot and calf.
Yeah. Classic, maybe to the big toe. Classically to the calf and heel, outside of the foot. But yeah, if it is kind of and the question we go back to is potentially my disc injury causing or the origin of my hip and groin pain. Yes, it's probably one of the the upper or the mid lumbar levels. That's what just Jake was telling you about, the different dermatomal and myotomal patterns that those things refer to.
Yeah. So then we'll go through tests, and we call this a peripheral response. So when you have symptoms in the leg, no matter where it is, you're peripheralizing away from the center of the spine. So we want to run you through some interventions, and if this is a true low back issue, what we should see, and this only takes 5-10 minutes to kind of dive into and figure out, is after we put you through some tests, we want to see that pain. If it's in the hip, we want to see it draw back up, or if it's in the back of the leg, we want to see it start to come back up closer to the spine. So we call that centralization, which that would pretty much guarantee that we have at least a low back component, if not the whole thing's going to be low back.
or at least reduce in intensity, or improve the mechanics of the So if you couldn't bend forward before, or you couldn't squat deep before because of that pain, and all of a sudden, we either have to move, a side glide, an extension, a flexion, something. We move the spine, and then all of a sudden, that moves better. Well, then we know at least part of that problem is in the back or coming from the back.
Absolutely.
Could there be a secondary issue in the hip? Yes, but you can't start chasing two things without first, going after one first, fully resolving it. Whatever's left, then go to the second. Because if you start going after two things at one time, it gets very confusing, and it's hard to then, help you and drop you into the right, bucket and the right treatment, and use the correct, and appropriate movements and exercises when you're chasing two things. You've got to fully resolve one, then go to the next one.
And just thinking about this in general, we get a lot of this information from the history when we start asking you questions when you come in. But for you to have a true hip issue, you're going to have some sort of trauma in most cases.
Yeah.
Every now and then we get some, osteoarthritic people that just have narrowing in the joint space with age. Not a big deal. You can still fix that. But large majority of the time, it's going to be referral from the spine.
Yeah.
And that's stuff we see and help with every day of the week.
Yeah. And they can mask each other.
Oh,
I mean, and so you could have that kind of situation where the back hurt for a while, and then all of a sudden you have hip pain, and it's something separate, but usually not. I mean, we deal a lot in horses here, not a lot in zebras. Like, it can look like a horse, it can sound like a horse. It probably is. Occasionally there's a crazy zebra, or even, rarer a unicorn, but 1%, yeah. But most things are what, they just come from that spine. Yeah. They resolve fairly quickly. But the difference is, so someone could do and work all these hip things and then not feel any different. So that's the one issue that you have to first, like you talked about, resolve and fully assess, vet out the lumbar spine in full, full flexion, full extension, side glide rotation, everything, with load, with end range, with overpressure. Make sure you fully, it takes a little bit of time, but it's worth, the time investment to make sure that it's not coming from there before you just zero in on where you feel the pain. We do the same thing with, shoulder, tricep, arm, elbow pain for the neck, and the same thing we do with the lower part, hip, groin, thigh, calf, heel. So you have to at least take that time to make sure that it's not coming from the lumbar spine, which many times it is. Once you're determined or sure that it's not, then you can move on to the next spot.
Yeah, and we actually have a case with one of our patients right now that we're both managing. He originally came in stating he had hip pain, had on an MRI shown like a hip issue, but we started diving him through a whole bunch of hip tests, squats. Nothing was producing it. Yeah. So we're like, okay, that doesn't make any sense. And then we dove into some low back stuff, and sure enough, he's got some low back referral in this case.
That's the other part is important, that we're telling you kind of what we, how we go about it, but it's the answers to the questions that we ask you that kind of give it away. There's usually some, little light bulbs that go off. What makes you worse? Oh, sitting. Okay, rising out of the chair. Okay, yeah, walking and loading. It feels better. Yeah. Like if you had a bad hip, a lot of time on it would feel worse. You could sit for a long time because you're not really bothering it. And there'd be a loss of no, I can move it. It just hurts with certain things. So it's what started it. How long have you had it? Better and worse. Constant or intermittent. Is there any kind of other pains, referrals anywhere else? So there's all these questions that we need the answers to help guide our movement, and the rest of our examination. But that's the importance of taking actual time with you, not just going into the doctor's office saying, hey, my hip hurts. They give you 5 minutes. They say, okay, try this and this. Yeah. Here's some medication. Here's an injection. Okay, come back in 3 weeks when it's not better. Like, that's all they're going to do. So if
you're dealing with something like this, feel free to reach out or find a provider near you that's going to dive into these tests. Mm-hmm. Check out, at least screen out the low back and see if that's where your issue could be coming from. Because if you're not treating the right thing, you're not going to get better. So comment below, ask us questions. Check out our video from yesterday. We talked about candidate herniation heal naturally. Yeah. So if you have more questions on that, we've got videos.
And
so check them out, and we'll catch you guys on the next one. See you later.